Obsessive Compulsive Disorder, Symptoms, Signs, and Treatments. Hi, I'm Michelle Risser, and I'm a licensed therapist specializing in perinatal mental health, including OCD. Let's go over obsessive compulsive disorder. In this video, we'll go over what is OCD, common symptoms of OCD, outward signs of OCD, recognizing different types of OCD, and OCD treatment. What is OCD? Obsessive compulsive disorder is a disorder characterized by intrusive, unwanted, repetitive thoughts, and/or compulsive behaviors. Most people with OCD describe struggling with both intrusive thoughts and compulsive behaviors. Excessive anxiety is common for people with OCD, usually rising in response to obsessions and falling in response to compulsions. The criteria used to diagnose OCD include the following symptoms: obsessions, which can include intrusive, unwanted, repetitive thoughts or urges that a person tries to actively suppress, neutralize, or ignore. Here are common OCD obsessions. The content of OCD obsessions varies, but usually they share these features. They come in the form of words, images, or impulses to act. People get stuck repeating or ruminating on them. They cause the person to question whether they are crazy, evil, or there's something wrong with them. They are fear-based, and the person is afraid that some aspect of the thought is real or true. And obsessions often neutralize in response to specific mental acts or behaviors known as compulsions. Compulsions are mental acts or behaviors that a person has strong urges to repeat. They provide some temporary relief from OCD symptoms, but they tend to become disruptive over time. Compulsions are defined as both repetitive mental acts like counting, praying, or repeating words, or behaviors or mental acts repeated in an attempt to prevent or reduce stress or anxiety. They don't usually have impact on the source of the anxiety. Some of the common types of compulsions people with OCD experience include checking, washing, ordering and organizing, collecting or hoarding, counting or repeating words or numbers, following rigid routines like hygiene or eating routines, repeating prayers or mantras, avoiding specific objects, places, or situations, doing research online, seeking reassurance from others. Outward signs of OCD. Signs that may indicate OCD include being consistently upset, anxious, or disgusted by the content of thought, feelings of going crazy or not being in control of one's thoughts or actions, noticing strong urges to engage in certain mental tasks like making lists or counting, noticing strong urges to engage in certain behaviors like hand washing, checking, or repeating a certain word, needing a high level of control in any situation or environment, needing to follow time-consuming routines or rigid processes to avoid feeling anxious, especially during times of stress, giving up necessary or enjoyable activities in order to engage in routines or ritualistic behaviors, difficulty tolerating irregularities in a task or situation or an interruption to a normal routine or process, avoiding certain situations, places, people, or things because of intense anxiety or intrusive thoughts, finding that intrusive thoughts or routines are occurring for 1 or more hours per day. Let's go over different types of OCD. Harm OCD centers around the fear of causing harm to self or others. Contamination OCD centers around fears of germs or disease. Symmetry OCD is when a person becomes obsessed with patterns and symmetry. Checking OCD involves checking behaviors like checking locks, pockets, or even part of your own body. Relationship OCD features a preoccupation with a relationship. Pedophilia OCD is a type of OCD where a person has intrusive sexual thoughts about children and becomes panicked that they may act on those thoughts. Emotional contamination OCD is a more rare subtype where obsessions focus on being negatively impacted by certain people, places, or energies. Existential OCD is a subtype where a person becomes obsessed with questions about the meaning of life, an individual's specific purpose, or doubt about the nature of reality. Sexual orientation OCD is a preoccupation with questions or doubts about sexual orientation or identity. Somatic OCD is focused on some aspect of one's body or health. Just right OCD is fixated on needing something to be just right. Pure O OCD. Some experts contest whether this type of OCD exists, but there is a subset of people who report that they only experience obsessions without any form of compulsions. OCD treatment. With treatment, people with OCD are often able to minimize the extent that their symptoms disrupt their lives and routines, and they learn ways to manage their symptoms. Treatment can include medication, therapy, or a combination of the two. Common treatments for OCD include cognitive behavioral therapy, or CBT, and exposure and response prevention, or ERP. OCD medication. Some people with OCD may benefit from psychiatric medication. These medications are typically prescribed by a healthcare professional with specialized experience in mental health treatment. On occasion, medication may be prescribed by a general practitioner or primary care provider. The most commonly prescribed medications for OCD are SRIs and SSRIs, antipsychotics, and benzodiazepines. Other treatment options. TMS is one other treatment option that has been shown to be successful in treating OCD. TMS involves passing magnetic pulses through the brain to stimulate the neurons of the brain. Final thoughts on OCD. Even though OCD can be quite impactful, helpful treatment options do exist. By receiving early therapy and medication services, a person can manage their symptoms and maintain a healthy, fulfilling professional and personal life.